Can we start off and talk a little bit about what's happening in the vaccine space? We had news over the last few hours regarding what is happening with the Moderna vaccine, the RNA vaccine. We're also now on tenterhooks waiting to hear news regarding the Oxford vaccine, the AstraZeneca vaccine. The difference between the two seems to be at the moment that there are indications that the Oxford vaccine does seem to produce some sort of T-cell response, some cellular level response. How critical is this for preparing the body and generating a longer term immune response to COVID-19?
Well, we know that there's two responses to the immune system that are important with the vaccine, the antibody response and the T-cell response. And sometimes the T-cell response is taken as a signal for longer-lived immunity, more robust immunity that's not reflected by antibody levels. So it's important to remember that since everybody focuses on antibodies so much, that there's this whole other arm of the immune system called T-cell immunity. And it's important for vaccines to do both. And that's one thing that we're hearing that the AstraZeneca vaccine is counting on, is robust T-cell immunity to prove their efficacy.
The Moderna data, Moderna published a lot of data. It was just that it does seem as if the T-cell bit is a little light in terms of the information that was being provided. So we're waiting to hear on that. Nevertheless, are we starting to get an understanding of how the different how the different vaccines are going to be able to treat the virus? And in terms of understanding how we are going to prepare the population for generating kind of long-term immunity that's going to allow us to get back. Are we going to be in a position where we're going to need to pick and choose the right vaccines for the right parts of the population?
I mean, that would actually be something that would be good, that we have more than one vaccine that actually makes it through phase 3 clinical trials and can be used so that we have a menu to choose from. And I think that would be ideal because we know that people respond to vaccines differently based on their age, based on other risk factors they may have for severe disease. So it may not be a one-size-fits-all shot. We may be able to do some precision medicine. For example, with influenza, we recommend certain vaccines to the elderly, certain vaccines to children, and other vaccines for the rest of the population. That would be ideal. We want to just get one vaccine, though, that gets through clinical trials and can be put into people's arms. And after that, I think everything else is kind of going to be a bonus.
What are you making? Let's turn to the wider picture. What are you making of the situation in America at the moment? 37 states are currently reporting climbing case counts. In terms of what is happening here, there does seem to be, though, a growing awareness of the need to wear masks. And I noted with interest yesterday Walmart's decision to make it mandatory in their stores. Are we reaching a tipping point where actually the population is beginning to understand the necessary behaviors in order to limit the virus spread?
I do think that many people realize that face coverings are what we need to do in order to keep businesses, restaurants, and the economy open without disruption, because this gives people some assurance that when they go out of their house that they're not going to be exposed to the virus, and it keeps outbreaks from occurring in certain areas where, for example, in a store, then the store has to shut down, and so many stores may not even want to open because they're so worried about getting cases. So this is increasingly seen as how we move forward, and I do think it's not just face masks, it's also face shields also coming to the fore as well. So I do think that this is what we'll see as the new normal for a period of time until we have a vaccine at least.
Are we also beginning to understand what it takes to allow people to interact inside? This is sitting here in London, and if you're in the Northeast in the United States, at the moment, and Tom was talking about this earlier in the show, you have the ability to eat and drink al fresco. You have the ability to socialize al fresco, to be outside. That is not going to be there forever. And as the fall comes, things are going to get to be a little bit more difficult. What are your expectations for us being able to kind of do this in the autumn, in the fall? And do you think that we are heading, if we can't manage that, for a significant rise of both influenza and also COVID-19 in the fall?
It is going to take some adjustment to understand how we can do things safely indoors. Outdoors is much easier to social distance, and we're seeing less transmission. but indoors, especially restaurants and bars, we're seeing in many case contact investigations being drivers of infection. So we have to come up with a way to either to decrease capacity, change the physical layout, maybe not have people congregating around a bar. We know in Japan, for example, people are wearing face shields at the bar and drinking from a straw. We have to have all of these options on the table if we're going to make these things viable and safe. And I do think in the fall, we are going to be contending with influenza at the same time as the coronavirus. That's inevitable. Influenza is still a major infectious disease threat, and it will be really important that we get people vaccinated against influenza so we can keep them out of the hospital so they're not competing for the same bed space that coronavirus victims will also need.